Hello and welcome, wherever you are in the world right now. Thank you for joining us. I'm Jo Yarker, Director of Affinity Health at Work, and I'm your host for today's session. I'm delighted to be convening this discussion with IOSH. IOSH is the world's chartered body for health and safety professionals. Today, we'll be sharing the findings from a research study for which IOSH was a co-sponsor, entitled Learning from the Covid-19 Pandemic, Approaches to Support Employee Health and Wellbeing. We'll be sharing findings from a project that followed the wellbeing journey of 5 organisations as they navigated that first 18 months of the pandemic. And we're going to explore how occupational safety and health professionals and all the partners in the organisation can learn from the diverse wellbeing activities that have been put in place over the pandemic so far. Over the course of the pandemic, our lives and our working lives have changed. With the vaccine programme underway in more than 190 countries worldwide, the future is looking hopeful. However, as we continue to respond to new variants and settle into a new rhythm of life, we'll continue to feel the impact of the pandemic for many years to come. The true impact of the pandemic on mental health and wellbeing is still unknown, but no one has been untouched. The loneliness of isolation, the stress of uncertainty around our routines, over changes in jobs, bereavements, and increased or changed care responsibilities. All of this takes its toll on an individual. We're also learning more about the longer term impacts that the virus has had, and particularly around long COVID, where we know that 1/10 of those who caught the virus are continuing to live with very real consequences of the virus on a day-to-day basis. What has been encouraging is the response of organisations. They've put in place so many different activities to protect and promote the mental health and wellbeing of their employees. From the very early stages of the pandemic, we saw so many health and safety professionals really taking the lead to develop new strategies and really strengthen their offer to protect and support their employees through training, counselling provision, and other activities. So today, we're going to explore how organisations have responded, specifically how that response was experienced by stakeholders and employees within the organisations, and then see what we can learn from this unique experience. I'm delighted to introduce our panel for today. First up, and also delivering a short opening presentation, is Clare Bowerman, Research Consultant at Affinity Health at Work. Hayley Farrell, Wellbeing Manager at EMCOR, will also be joining us to talk through their experience, and then we'll move on to a panel discussion. So Clare, I'll hand over to you.
Thank you for your introduction, Jo. So as Jo has said, I'm going to share with you a short presentation which will give you an overview of this research project. And as Jo has explained, this is entitled Learnings from the COVID-19 Pandemic. So just to start off, I want to take you through the aims and the methodology for this research. The project was inspired by the unique and in many ways exceptional circumstances of COVID-19 and its impact on the world of work. The world's seen pandemics and epidemics before, but they've generally been geographically confined, and none of them have had the sweeping changes and alterations and adjustments needed within the workplace that we've seen with COVID-19. And the aim of our research was to understand well-being outcomes of the pandemic for employees, managers, and different organisations. We wanted to know how organisations could effectively support employee health and well-being in the period, what had worked and what had worked less well. And we wanted to look at the barriers and facilitators to health and well-being. And finally, the aim of the research was to develop evidence-based recommendations for employee health and well-being that can serve throughout the course of the current pandemic, which is still ongoing, but also for any future disease outbreak or similar situation or emergency, since we know that pandemics and epidemics will remain a growing risk in the future. To talk you briefly through the methodology for this research, we interviewed 5 different organisations. The organisations were all large and complex, and all of them operated across multiple sites. But they had some key differences too. They were drawn from education, from the private sector, and from the public sector, and they differed in the amount and proportion of employees in these contexts who were required to remain on the front line throughout the pandemic, and the proportion who were able to transfer to home working. The research project was supported by a rapid evidence review, where we looked at interventions that had been utilised in past pandemics, such as SARS and Ebola outbreaks, and also the emerging research on COVID-19 that's so far been published. And the project was conducted across 3 waves. And these waves meant that we did 3 sets of interviews between November 2020 and June 21. And in that period, we saw a lockdown in January. And then towards the end of that period, we'd started to see organisations preparing their staff for return to work. So there were some different challenges at each time point. We conducted 39 interviews with stakeholders who had expert knowledge of health and wellbeing. And then we also conducted 33 interviews, 3 focus groups with managers, and 5 interviews and 17 focus groups with employees. So we were drawing here upon a large data set. I'm going to take you now through the core findings from this pandemic. And what you'll see on your screen is that these findings, in terms of the impact of COVID-19 upon these groups, differed according to times. So at time 1, we saw some different trends to those that we experienced at time 3. Particularly at the start of the pandemic, we saw the employees and managers and other stakeholders all talked about a serious impact on their mental health and well-being. And at time 2, which relates to interviews held right in the middle of lockdown, we found that all of our participants were experiencing weariness and fatigue related, for example, to participants who'd had to homeschool at the same time as completing their jobs. Across all time points, we saw challenges with working from home, and those could be physical challenges of having appropriate space and challenges of establishing boundaries. We also saw throughout the stages of the research that there were increased operational demands. Some people talked about a COVID workload, the extra work that they were having to do simply to do their job and manage the COVID situation. But the workload also related to difficulties in simply switching off at the end of the day. There were also positive outcomes from the pandemic, and this is very important for us to remember as we look forwards. Many participants talked about things that they appreciated, including having more time to spend with their families and reduced commute time. And finally, as we looked at time 3, we noted that there were many particular concerns as participants in this research, whether those were employees or managers or stakeholders, looked to the future. Many people talked about their growing sense of unease and uncertainty. Is this really it? What's it going to be like going back to work? What's going to happen with COVID? And we also learned about cumulative impacts on health and performance that so many people were enduring by the 3rd wave of our project. Many felt that their mental and physical health had really been under strain for a long time, and they hadn't had sufficient opportunity for recovery. I now want to just turn to reflect on what participants in this research said their organisations had done to respond to the pandemic. And again, here we can see, as we look from times 1 to time 3, that there are some clear differences and clear trends. And one thing I wanted to note is that just because a particular strength is mentioned at time 1 doesn't mean it wasn't also there at time 3, just that theme was particularly dominant in the responses that our participants gave. So broadly speaking, at the start of our pandemic, what we found is that participants were in full emergency response mode. And really from across organisations, participants talked of the many learning opportunities that their organisations had laid on. They talked about different forms of data collection that their organisations had used to judge how employees were doing and to provide a benchmark, which was then used as the pandemic progressed. There was a particular early emphasis on communications and on leveraging assets and strengths, particularly in the emergency response. So, for example, by raising awareness of EAPs and existing policies or tweaking these policies to meet the needs of the situation. And at the start of the pandemic and throughout, we saw some differences in responses from staff who were remaining on the front line, who tended to emphasise health and safety and the measures and interventions that had been laid on in this area, and those who transferred to home working, who were particularly focused on sort of psychological interventions. But as we moved through to the second and then third wave of the pandemic, what we noted is that organisations were increasingly mature in their responses. Many people talked about differentiating the responses that were laid on, that is, making sure that different groups of people within their organisations had tailored support, tailored interventions, and tailored communications to meet their wellbeing needs. And we also found, and this is probably in response to that finding that I discussed earlier, of the real challenges that people face in terms of their workload, that by time 3, many organisations were considering issues to do with job design, the future of work and the future of roles, particularly as organisations looked forward to a future where hybrid working arrangements might be the norm. And finally, throughout the course of the pandemic, and through the 3 waves of the research, all of our participants talked about the barriers and facilitators to addressing and managing employee wellbeing that they personally had encountered. And these barriers and facilitators are presented here in the IGLOO model. And the IGLOO model looks at the resources and the strengths that are available to people at many different levels, starting from the individual through to the group, the organisation, and the overarching cultural factors that can actually help or hinder us when it comes to wellbeing. So at an individual level, we noted factors such as the use of stress management tools and as resources as a facilitator for some. At the group level, we noticed the importance of colleagues, of the team in kind of keeping us well and supporting our well-being. At the leader level, messaging was absolutely key, those consistent messages from senior leaders. And within the organisation, taking a really strategic and planned approach to well-being mattered. But I just wanted to highlight that one theme that was really integrated throughout responses, throughout what participants felt about well-being, was the importance of people. So this was the incredible importance of colleagues, of comrades, of friends that we had in organisations and existing relationships in keeping us going. But particularly the role of the line manager emerged as a barrier or a facilitator, depending on how capable and able that line manager was to support employees. But we had another finding too, which is by the 3rd stage, particularly of the pandemic, many managers were worn out with the demands that were on them. And this is something that's very important to consider for the future, in that line managers are clearly pivotal in supporting well-being during crises such as this one, but they themselves require sufficient support in order to fulfill that task effectively. And finally, based upon all of these findings, we've developed a series of recommendations, and you can see these recommendations on your screen now. I'll read them through very briefly, but I know we'll be picking up again on them in our discussions. The first recommendation: it is critical to demonstrate senior management commitment to employee health and wellbeing. This was a finding throughout the research, where senior managers were visible champions, employees appreciated it. The second recommendation, focus on line managers. We need to give line managers the skills and the resources that they need to do their jobs well. Third, we need to prioritize job design together with employees. Employees want different things, but they need well-designed work that's manageable. And this has been a challenge in this period. Promote an environment of social connection and trust. Communicate your well-being approach consistently and continually. We were amazed in this research that different participants from the same organization could in some cases experience the organization so very differently. In order that we get our messages across clearly, they really do need to be consistent, and we need to consistently signpost resources. Embed well-being across policies and practices. In the end, a superficial approach to well-being doesn't work, and it was the better integrated responses and interventions that landed the best. Conduct an internal audit of your well-being provision to identify existing development areas. And finally, monitor your organizational well-being. You know, it was those organizations that established strong benchmarks at the start who were then able to track how the organization and colleagues were doing throughout the course of the pandemic. So that was just a brief whistle-stop tour. And thank you for that. I'm sure we'll pick up on some questions relating to that research later. But I would now like to introduce you to Hayley Farrell. Hayley comes from EMCOR UK, where she is a wellbeing manager. And EMCOR UK was one of our participating organisations in this research. So without further ado, I'd love to hand over so Hayley can talk about her experiences.
Thank you, Claire, and thank you for that great overview and some really interesting findings and outcomes. I'm Hayley Farrell, as Claire's mentioned. I'm the Wellbeing Manager at EMCOR UK. We're an integrated facilities management company with 4,100 employees over about 17,000 sites. So as Claire alluded, one of our biggest challenges was the fact that we have a distributed workforce working across a number of different sites. How do we communicate with them, and how do we make them feel that we really do care about their well-being? Some of the challenges in addition to that was the fact that whilst we're working remotely on different sites pre-pandemic, we had some of our colleagues who were furloughed, some colleagues who could work from home, excuse me, and other colleagues who were frontline workers and had to be on site every single day. So we really had a number of different emotions and different challenges that were presented in the day-to-day lives of our colleagues as they were in different environments. In addition, we went through a rebranding process in the middle of last year, which meant we changed our purpose and values and the whole color of our business, which was actually a huge step change for us. One, to make our purpose to create a better world at work, and pivotal to that was our people. With this step change, saw the role of well-being moving out of a space where it wasn't really owned by anybody and into a space alongside physical safety, so health and safety operations, alongside risk, technical compliance, sustainability, and social value. And this was when we finally idealized well-being as being pivotal to the safety of our colleagues. And in doing so, I think demonstrated the commitment to the organization that whilst we'd started to do a lot of fantastic proactive and promotional well-being things, we were really focusing on how do we embed this and how does this become a 5-year strategy. It's not just something that we're doing as we're reacting to the pandemic, rightly so, but trying to embed in our people that this is the journey that we are now taking as part of the rebranding and as part of putting people at the center. Some of the tactical things we did to respond was support our line managers through line manager training, resilience training, also identifying early warning signs of mental ill health. Also encouraging employees to take a proactive approach, so offering things like Thrive programs. How can you flourish and thrive in your own well-being, and what actions can you take as well? Whilst I think there are a number of promotional activities that we undertook, to name a few, we focused on men's health, we focused on suicide prevention, we focused on our digital charter, on making sure that people had boundaries between home and work life. We also focused on women's health. Key to all of this was the adoption of 27500, the human-centered organization, with the idea that we were going to adopt 45003, which was this risk-based approach. And Claire spoke about job design, she spoke about good work and psychological safety, and it really helps us understand risk. So what are the risks in the workplace that are impacting mental health and well-being, and how do we take a preventative approach? So that's really, I think, in a nutshell, the journey has been that we've learned along the way. We've done a lot of good things to help support line managers, frontline, and develop a pool of resources and webinars that people can tap into. But at the same time, it's imperative that we really drill down, and this is not a sprint. It's definitely a journey, and an authentic one, to get to those root cause issues and systemic potential hazards and risks that we need to address to really make long-term change, I think, in the health and well-being space. Thanks, Claire. I think that wraps up some of our journey, and I will hand back over to Jo and Claire now. Thank you.
Thank you. Thank you both, Claire and Hayley, for sharing such great insights. I think one of the things that really comes through is this segue really into prevention and looking at job design and the need to think about risk, which is really exciting, I think, in terms of our journey in promoting well-being and protecting well-being. So it's really, really wonderful to hear that come through. And I'm sure for many occupational safety and health professionals, it's something that they have often struggled to get on the agenda as well, when we're talking broadly around managing well-being in the workplace. So it's great to see that trajectory. So we just wanted to spend some time really thinking about those recommendations and really wondering how they are best operationalized. So we know we need to achieve these things. We know we need to work towards them. And in our discussion, hopefully we'll share some good ideas around how we make that happen. And so one of the first questions I'd like to throw out to you is, you touched on it, Hayley, there, was around how can an organisation demonstrate its commitment to ensuring health and safety and well-being of their people? I suppose there's that difference between showing that they genuinely care or that it's just lip service. And I was just wondering if you wanted to provide a little bit more about what you did there.
Thanks, Jo. I think we hear it so much is how do we get leadership buy-in? And I think that is critical. We have to have it as a conversation at the executive leadership team table or in the C-suite. How do you do that? I think the challenge in this space is often around monetizing and measurement, and how do we answer the so what question? Why should we be looking after our people? And I think we've often looked at potentially lagging data from an HR space. We'll be looking at absenteeism data, would potentially be looking at engagement survey data. But I think we're really starting to move much more into this risk space, and a piece of potential advice, and I think something that can drive this space, is taking a risk-based approach in the same way that you would do it for physical safety. And I always think about what Wolfgang Seidel says about mental health and physical health. Treat mental health in the same way you would treat a physical absence when somebody comes back in. Don't be scared to talk about it, but let's treat it in the same way. And therefore, it should be in a risk register. Because if we're treating physical safety as a risk to a business, we should be doing the same with mental health and well-being. So I think leaning away from potentially lagging data and using a risk-based approach helps get that C-suite buy-in. But I do think that you need to have it driven from the top, role model from the top, and really integral to culture and to the behaviors that you want people to be doing every single day. It's behavior for me.
Absolutely. I wonder, Claire, did you see anything different to add to that in the other organisations that you worked with?
I would say that in many respects, what Hayley has said and also EMCOR UK's approach in this respect does pretty much summarise it. You know, there's a saying that trust takes years to build and seconds to break. And in terms of those years of building, it really is about focusing on that integrated approach, you know, ensuring that health and well-being is truly integrated and not simply cursory. And it's about demonstrating that from senior leaders that health and well-being is a priority. This emerged across organizations, but also making sure that that voice of senior leaders actually gets to everybody in the organization. Because often it's, and I would say this is something that we did see during the course of our research, it's often much easier to reach people in the center of an organization, you know, within the core professional services function, and much harder to reach people who might sit at the outskirts of an organization. So in order to be a truly kind of trusted, you do need to focus on those different groups in the outskirts with your core messages, with your core provision, as well as those at the center.
Absolutely. And I think within all of those different groups, that role of taking action and having that visible action as well to demonstrate the words that you're committing to is so important, isn't it? Making sure that you have that follow through, because that will generate the trust. Thank you. And so another area, we've mentioned line managers so many times in terms of the way that they are so important in looking after the people in their organisation, and also recognising that they themselves need to be supported both in their own well-being and their skills. And I'd just be interested in some of the key skills and responses that you've seen have been helpful for line managers. What do you see as important to put in place?
I think one of the biggest challenges for line managers is operational delivery and stretch. And I think for it to come from the top that this is one of our organizational objectives, and therefore there is an accountability element, but also an objective and an appraisal, looking after your people or making sure that your people are safe, gives people the time and the permission. Because I think, to Claire's earlier point, it's still seen as an add-on. It's still seen as something else that I have to do as part of my line manager role. I now need to take 5 minutes out of my day to check in on people. And I would argue that that is what we should be doing as line managers and as good people. But we forget that those line managers are also just people. And given the COVID pandemic, I think everybody was so stretched in so many different ways that there wasn't often a lot to give anywhere else. Demanding workloads and requests from clients and customers. And the old saying goes, the customer is always right, and the potential risk that has on the impact of our people. So I think giving line managers, firstly, the tools, and that comes down to competency framework. I think aligning technical competency and people competency is important, and then giving them the time to do that. So almost saying that 20% of your role should be focusing on people, training, inclusivity, diversity, because all those good things lead into a psychologically safe working environment. But we can't be sending another team talk and another newsletter and another thing to be done on this off the side of the desk when we're expecting them to still deliver an operational role. I think that's the biggest lesson learned for us and for many organizations.
I think that really resonates with the work that we did many years ago for the Health and Safety Executive, looking at line management competencies to prevent and reduce work stress. And the idea being that we can't have it as an extra, it needs to be integrated. And actually, many line managers are selected into their role on the basis of competencies. They're promoted on the basis of competencies. So if we can make sure that we've got those competencies embedded into all behavioural systems that we're using in the organisation, we've got a much better chance of promoting health and protecting our employees in the long run as well. So really pleased that you're focusing on that behavioural piece, because I think often we see the role of providing mental health awareness rather than providing the time and providing the key skills, and it needs to be all of those things, doesn't it, to take forward. So another area that we identified as a key priority is around that social connection, and also what makes a good job. And so I was wondering how you would define a good job. And so what's the secret ingredient? And Claire, you listen to lots of people in different roles across many different organizations. And I was just wondering what you saw as creating that good job.
Oh, that's a $1 million question, that one is, Jo. I guess there's two different elements to it. There's a sort of an objective element, if you like, of where people tend of the ingredients of a good job. So there are the elements such as having a supportive line manager, having some clarity about your role, something that frankly often slipped a little bit during the pandemic when people had tasks flying at them from all directions, having a manageable workload. These are all attributes of a good job. Having sufficient support, knowing where the role is going, having the resources that were needed to do the job well. I was amazed by the number of people in the course of this research who said that one of their main stressors was having to suddenly use all of these new technological platforms all in one go alongside work, and how that really was very challenging for their working day. So those are some of the elements of a good job. But I also think it's really important to say here that what's good for me might not be what's good for you. And so having autonomy in the role and the opportunity to actually shape the working day was really emerged as incredibly important in this research in terms of, I would say, people's gratitude. You know, for some people, the Covid-19 pandemic's actually offered flexibilities in terms of how they work and balance that with their personal life that they've never had before. And some people were full of gratitude for the opportunity to shape and craft their work. And I think that's very important as we go forwards into the future.
Thank you. And so thinking about how work is different for everybody, and we all have that different propensity to want social interaction, particularly with that segue into many people working from home. And Hayley, you described that you had a really split workforce where many were on site, many were transitioning to the home working environment. Why do you think social communication is so important, and how did you manage to nurture it when you were working across so many different environments?
I think social communication or social connection really feeds into good work, because it gives you that purpose, that meaning, and that sense of we're in it together, specifically in the COVID-19 pandemic. I know that a lot of people were looking forward to returning to the office when they could, so that they could have those water cooler chats and go and make that coffee and that tea. So what we encouraged to do, our colleagues and our line managers to do, was to make time in diaries for those conversations that matter, but didn't need to have an outcome or a purpose. Because often what would happen is you would phone in to check on a colleague, but at the same time, in the next breath, you would say, oh, have you finished that spreadsheet? Or, oh, we need to get that job done by Friday. it was really prioritizing well-being conversations. And we put together a framework about how to have these conversations, what you should think about in terms of the timing, the location, the kinds of questions you can ask. We also used our pillars of well-being, such as mental health, financial well-being, physical, and our 6 ways to well-being. And we kind of said, ask people questions about connection, about being active, you know, so we kind of gave people some guidelines and some frameworks to work with. What was very challenging for us, though, is we are a distributed workforce. So we had to give the contracts and our colleagues tools. And then we had to say, you need to take a tailored, localized approach. You need to adopt these tools to work either in a team talk or a toolbox talk or a virtual conversation, but we couldn't monitor that. What we did to support that is deliver our own maturity model, which would be owned by an account manager, and they could then identify areas that they should be thinking about to look after the different areas of well-being. And I've kind of spoken about those pillars, but there's got to be that accountability as well.
Sounds brilliant. And as you were alluding to earlier, it's a continual journey, isn't it? We have to keep trying new things and different things as we go through. Did you hear of anything else, Claire?
Oh yes, and I would echo actually what Hayley said about the way that social interactions often need to be highly localized. And I heard some from across organizations, particularly from people who are in wellbeing champion roles and similar roles, of some really wonderful and innovative ways of connecting people, from, you know, have a ring round of different colleagues every week, through to virtual coffee mornings and virtual walks and virtual kind of nature trails. So lots of different examples there. What actually struck me really about was that although the pandemic and having virtual interactions rather than face-to-face interactions definitely presented some challenges, many of the participants that I spoke to said that it also enabled the inclusion of some different people who might not have been included before, that those virtual social interactions brought new groups and new configurations together, and was a real benefit for some. And I think there's something that we can really learn from that in terms of shaking it up a bit within organizations and really supporting different groups of people to get the benefit from social interactions.
Yeah, that's a really interesting point, isn't it? And I think it also links really well to my next question, which is around how do we really make sure that we provide access to everybody and we encourage uptake from everybody when it comes to using those wellbeing resources? Because some people are so proactive at taking what is there and really actioning it for themselves, but others might never know that they're there. And if they do know that they're there, they might not necessarily be galvanized to take action and implement some of these frameworks or tools for themselves. So what else have you seen be used to really encourage people to use those wellbeing resources? And why is a broader approach necessary?
I think this is $1 million question, Jo, because engagement in communication and in resources is such a challenge across a distributed workforce. And how do you monitor that and kind of measure it? And then you've also got things like age demographics that are barriers to accessing resources. So I think one of my views from quite early on was that there is an element of self-management, and that is through education and awareness. And you've got to take this integrated approach alongside your HR teams, because if we're talking about an HR process, we need to look at both strands. We need to say, there is a lot of resources. What are you as an individual using to support you in this situation? Because it can't all sit on the employer's responsibility. The employee has to have an element of, what am I doing to help myself? Where the employer needs to look at it from their risk is when they are impacting that. So are they exacerbating? Are they taking away the autonomy? Are they putting too much demand on an employee who is struggling already due to stress and mental health? How to bring people along on that journey with you and get them to engage. I think it needs to be authentic. It needs to be a movement. It's not one person's role. It's not the role of myself as wellbeing manager. The champions are important. The other networks, so whether it be the LGBTQ+ or the identity network, they've got a strong tie into mental health and wellbeing. So it shouldn't be done in isolation. It needs to be integrated, integrating it with the safety approach really starts to see it as a behavioral thing and not just read the nutrition booklet because, you know, it's January and everybody needs to make sure they cut out and look after their bodies. You know, it needs to be more than just one webinar, one booklet on sleep. It needs to have that golden thread. I think will get more people to buy into it and believe it. And consistency. It's not a sprint. I mean, we're doing this because it needs to be sustainable for the people coming through the door so that it's not such an uphill battle. In 10 years' time, it's normal.
Absolutely. What a lovely way to look at it. That sounds absolutely fantastic. It's creating that environment that then means everyone can continue to thrive over the long term. And it really speaks actually to our next question, which is around that embedding the wellbeing culture. And so we've talked about that need to ensure that it's embedded at every single level of the organisation, and also for many organisations when we're working with contractors or other collaborators. And so how exactly do we develop that culture? And I think many of those things that you've mentioned there, Hayley, really point to developing a wellbeing culture. But Clare, I was just wondering if you had any great examples of other organisations seeking to embed their culture in different ways.
Yeah, I mean, I'd say in terms of really embedding that culture and really gaining consistency, particularly during the pandemic, I think that mental health storytelling was an incredibly powerful tool. I think that having leaders at all levels talking authentically about their own experiences and prioritizing well-being in their communications was an incredibly powerful tool. You know, both because it gave people throughout the organization permission to also see themselves from a well-being perspective, but also perhaps because it led weight to the message that this is an organization and this is a culture that genuinely cares about health and well-being.
That genuine theme coming through again and again is there, isn't it? And really driving that consistency. I think with all of these different areas, you can see how they really do feed across each other. And so thinking about the wellbeing strategy, Hayley, you went through a process of reimagining what you were going to do and rebranding that approach. And I was just wondering what you need to do to understand and work out what your wellbeing strategy should be. And also therefore what kind of benchmarking you need to do to then see how much progress you've made. I was wondering if you could talk to that, having just been through that journey.
I think strategy is all about what it means to your business. So what does well-being, health and well-being, health and safety mean to you? And what is your data telling you? So what are your potentially lagging data, because it might be all you've got, be it absenteeism, engagement surveys, which you could argue could be more leading, occupational health data, employee assistance program data. What is it telling you and what are your focus areas? That really helps you, I think, develop some of your key potential campaigns or initiatives that you want to focus on. But I think there's that element of education and awareness for individuals. So that's kind of frontline. You've then got your line manager pocket that you need to focus on in terms of competency and training. And then you've got that tone from the top, which is the C-suite, and thinking about how they can role model, storytell, and behave. And I think that comes to objective setting and accountability. So in terms of measuring, I do not think that anybody has hit the golden nugget on measuring health and well-being as yet. What we do is maturity. So looking at the maturity in terms of well-being performance indicators that we set ourselves. One of them in there is actually health surveillance, because we need to have the solid foundation. Otherwise, you are building a house on sand. And if you're not looking after the kind of physical risks that might be impacting, you can't really start doing things in your well-being strategy without looking at the risks that are inherent already. So I think it needs to be personalized to each organization. Risk-based, as I've mentioned, I am a strong believer of a risk-based approach through risk assessment. That way you can start to monitor hazards, control them, monitor the level of risk that you're seeing, and also consultation and focus groups. And I think that what was great about this piece of work that we did over, we had 3 interviews with different key stakeholders. Qualitative data is also really important in this space, not just quantitative. And that really helps demonstrate that impact.
Absolutely, it's a really broad range of measures.
Yeah, there's no one size fits all, unfortunately.
Absolutely. And Claire, I wondered if there are any other KPIs that you saw organisations use across the projects, and also how they decided to measure that progress against them.
Yeah, that's an interesting point. I'd say, really, to reflect again what Hayley has said, there's no easy answer to this question in terms of well-being KPIs. And I'd say that for the most part, the organisations that we saw looked at general measures of engagement. So sometimes people look directly at well-being, and sometimes broader measures of engagement. They looked at feedback and engagement with the particular interventions that they had on offer. But they were also assessing their maturity. They were also assessing how well they offered support to particular groups. So some of the things that we saw during the research and during the course of the pandemic, following, for example, a realization that people with disabilities or pre-existing kind of mental health problems actually were experiencing the pandemic more negatively and experiencing organizational responses more negatively than other groups, was a kind of growth in the efforts to actually meet the needs of those particular groups. And that was a performance indicator.
Yeah.
Also, that risk-based approach, not just in terms of health surveillance, which Hayley's mentioned, and that risk-based approach for frontline workers, but also assessing risks for workers who were, for instance, transferred to home working practices and might face particular risks in those environments, such as from domestic violence. We saw many measures to look at how the needs of those groups were being met.
Thank you. I think it really shines a light on the need to have a diverse and multi-method approach, doesn't it? And also looking outside of your organisation, because you only know what the answers to the questions you're asking. And sometimes we're not asking the right questions. So we might need to ask different questions to be able to identify pockets of risk or even pockets of strength that we might not be recognising in what we're doing. So thank you so much. That draws us to a close of what's been a really thought-provoking and important discussion, I think full of practical tips for others to to consider as to how they might take into their own practice, but also give us an opportunity to reflect on some of those key challenges that we've both been through and also are now facing as we move on. So there's just time for me to thank our panelists, Clare Bowerman and Hayley Farrell. And thank you ever so much for your time today as well. So may I thank every one of you for listening to this webinar. You can find the full report online, Learnings in the COVID Pandemic, Approaches and Support to Employee Health and Wellbeing on the IOSH website. And I'd also like to thank our consortium members who sponsored the research, and also to all those who contributed so openly and generously with their time through that 3-wave study. A lot of time was given up by people to really share their experiences. And in particular to IOSH for supporting the dissemination of this work so that we can all benefit from the learnings and those can be shared more widely. Please be sure to check out IOSH's online COVID resources. You can see on the page there's lots more interesting content that can support your work. So once again, thank you for joining us. Stay safe and stay well. Goodbye.